Hello, we are Peter Foy, Missy Neelands, and Amy Williams of Group 9, Program Planning and Evaluation. Our proposed health intervention is called COW, Cancer Care on Wheels. This intervention focuses on eliminating barriers to cancer prevention methods in 6 frontier counties of Oregon: Baker, Grant, Harney, Lake, Malheur, and Wheeler counties. CAL will provide screening methods for cervical, prostate, and breast cancers. Working in cooperation with the communities of these 6 counties, CAL will focus on improving the rates of preventative cancer screenings rather than comprehensive cancer treatment. Throughout our research and interviews over the course of the term, we have discovered that having preventative strategies in place in rural and frontier areas will be a fundamental aspect of the foundation to equitable cancer care, as well as lessen the overall burden of the implementation of major programs. The Oregon Office of Rural Health defines rural as any geographic area that is 10 miles or more from a population center of 40,000 people or more. Frontier counties are those with 6 or fewer people per square mile. Of Oregon's 36 counties, 10 are designated by ORH as frontier. The CDC recommends individuals begin cervical cancer screenings at age 21, breast cancer screening at 40, and prostate cancer screening at 50. The median age of the populations of COW service area is 48.3. The service area of COW will include these 6 frontier counties from central Oregon to southeastern Oregon. Wheeler County is the smallest county in the state at a population of 1,366 people, and Malheur is the largest county with a population of 30,725. The space and size of these counties are staggering. Take, for example, Malheur County, which is around a 238-mile drive north to south. That is roughly the same distance as driving from Portland to Grants Pass. According to the Oregon Health Authority, the average death rate of cancer for rural counties in Oregon is 154.9 per 100,000 persons. The average death rate of cancer for urban counties in Oregon is 135.8 per 100,000 persons. Barriers to care include long distances to appropriate facilities, insufficient treatment options, and a lack of specialists, as well as financial barriers. For many frontier residents of Oregon, accessing care for cancer treatment is a challenge that affects financial welfare, family, and quality of life.
In all honesty, treating rural cancer care is a massive undertaking, and the easiest solution would be to get ahead of the problem and focus on prevention. There are many aspects of prevention as well as outcomes. Aspects can include comprehensive communication between primary care doctors and patients, educating patients, allowing them to have access to early diagnosis of cancer screenings, and access to follow-up screenings. Outcomes can act as a foundation to equitable cancer care, lessen the overall burden of implementation of a major program, as well as increase cancer screening rates among Oregon's frontier populations. So how do we provide prevention, as well as break down barriers to care and focus on a target population? What I would like to do is introduce you to Cancer Care on Wheels, or COW for short. COW is a program implementation that would implement a mobile cancer screening unit that travels to frontier counties in Oregon to carry out cancer screenings. It will also aim to help community leaders and residents in educating the at-risk populations on the importance of prevention methods. Because of the size and isolation of these geographies, it will be important to partner with community leaders who have an intimate knowledge of the counties COW is trying to serve. Let's revisit the service map. As you can see, COW aims to serve the lower southeastern corner of our state. This area in which COW will cover is very immense. So how does COW cover all that space? It is a mobile cancer screening unit that will travel to Baker, Grant, Harney, Lake, Malheur, and Wheeler County to provide preventative and follow-up cancer screenings of breast, cervical, and prostate cancers. In the image provided on the slide, you can see a sample floor plan of a mobile cancer screening unit. Ideally, it is a bus that has been retrofitted with medical and screening equipment that allows it to move safely and provide accurate imaging to those in frontier counties. Now that we know what it is, how do we provide awareness of COW? Physician contact, physical and social marketing campaigns, multi-level accessibility options, and community leader endorsement will all be effective ways of providing awareness of COW. Physician contact includes primary care physicians that will assist and educate patients on the availability of COW, reminders being sent to patients via postcards, emails, and texts. Physical and social marketing campaigns utilizing direct mail, billboards, social network platforms, mass texts, local newspapers, as well as patients having access to a phone application, website, or 1-800 hotline that allows them to track and schedule COW. And lastly, community leader endorsement, where public figures and local government officials, as well as religious leaders within the communities, share the knowledge of COW.
The long-term goal for C.O.W is to create a widely used network of mobile cancer screening units that provide equitable screening and care for Oregon's frontier residents of the 6 counties. Short-term goals include purchase, develop, and retrofit an appropriate vehicle that will serve as the screening tool. We will also need to find a staff for that, which is part of the goal. Another goal is to create and schedule travel for the vehicle, and we will need to seek permissions from counties and local communities for COW to be able to serve. The third goal, short-term goal, is develop and initiate a marketing campaign. A big success for COW is based on the awareness for this health initiative. So marketing campaign will include website, mobile app, as well as advertising such as billboards, direct mail, and ads through other local community resources. Long-term goals for COW are going to be developing survey results through baseline, progress, and outcome survey. Increase the health outcomes of these Oregon Frontier County residents by getting them screened for the appropriate screening methods, and education reforms aimed at changing the mind and behavior towards cancer screenings. Data collection is an important aspect of COW, and it's broken down into 3 sections: baseline, progress, and outcome. The first phase will be baseline, aimed at targeting the entire priority population through a simple random sample of all 6 frontier counties. Progress will measure current usage of COW from people who've used them against the results of the baseline, and that will happen in 2 years after COW is initiated. And then the outcome is the third and final phase, and it's to measure the successful implementation of our health intervention, COW, and this will happen after 5 years. Baseline survey questions will gather information on the priority population's current health standing. Questions such as which county they live in, who their primary care doctor is, whether they've been screened, what type of screenings they have had, and how they travel for those screenings. Baseline questions will also inquire about their occupation and current financial standing. Progress will be given to residents who used COW and be compared against the baseline results. These survey questions will include what they were screened for, what type of screen they had, and where they accessed COW. This survey will be done 2 years into the health initiative. Outcome survey questions will be done after a 5-year study and given to all people who had used COW in the 5-year. It will ask them how many times they used it, which type of screenings they got and how many of them did they get, and the locations where they accessed COW. Once again, outcome will be compared against the baseline study. Successful implementation of COW will eliminate present-day barriers for frontier residents. These barriers include financial struggles for expensive screenings, transportation to get to these screenings, inequitable access to screening methods, and the long distance that is required for many of these frontier residents. Our hope for the future is by using preventative health implementation with a focus on education is that we lessen the burden of complex cancer care for Frontier residents and avoid it early by getting in front of the problem before cancer strikes. COW will save resources and help rural residents in the long run. It will shrink disparities, eliminate barriers, and serve a valuable and important population of Frontier residents.